The coronavirus is not letting up in the U.S. despite lawmakers using alternative measures to get the vaccine to the American people. That includes calling in the National Guard to help distribute the vaccine and train volunteers on administering it. This virus has infected more than 21 million people since the start of the pandemic. That is nearly the entire population of Florida. More than 357,000 Americans have died from this virus. As for hospitalizations, nearly 132,000 people are in the hospital right now because of the virus. More than 23,000 of them are in the ICU. Nearly 8,000 of them are on a ventilator. For more, I want to bring in Dr. Ashish Jha. He is the Dean for the School of Public Health at Brown University. Dr. Jha, welcome. So great to have you with us. More than 3,700 people lost their lives to this virus on Tuesday alone. Are we still in the holiday surge from Thanksgiving, or are we just now seeing a spike from Christmas?
Yeah, thank you for having me on. We are seeing some of the effects of Thanksgiving still in terms of deaths. Remember, deaths can lag 4 to 6 weeks from the day that the infection happened. And we have not largely seen the effects of the Christmas holiday season yet. Maybe the beginnings of the spike that we'll see in infections, but the hospitalizations and deaths that result from the holiday season, from the Christmas holiday season, we probably won't see for several more weeks.
And let's turn to California quickly. The state is the epicenter right now for the country in terms of this virus. Things have gotten so bad there. Hospitals are rationing oxygen for patients and even turning away ambulances transporting patients. So what do you make of this? It's sort of hard to hear that happening in this country.
It's incredibly hard to hear this happening in this country and happening in a city like Los Angeles, a major global city with incredible amount of resources. But the problem is that when you have a public health disaster, as we do in our country, the health system can only cope so much. And again, we've seen this kind of disaster happening in LA over the last few weeks. Again, it would have been really helpful for the federal government to have gotten more resources there. The idea that we're running out of oxygen, again, this usually happens in low-income countries. Really surprised to see it happening here.
And as a physician, what concerns you the most regarding not just the speed and distribution of the vaccine and the vaccine itself, but how concerned are you about these new strains, specifically the one coming out of South Africa?
Yeah, I'm concerned. There's the South Africa strain, there's the UK strain. Both of them, we know more about the UK one. Both of them appear to be far more contagious. That's a real problem because that means that those variants are going to spread more quickly. Now, we don't know if the South Africa strain is here. We definitely have very good evidence that the UK strain is probably in every part of the country. I'm very, very worried about what this is going to mean in terms of number of infections, hospitalizations, and deaths in the weeks to come. And I expect by March, this will become the dominant variant across the whole country.
And then in terms of the vaccines, what do you think needs to happen? How much more quickly do they need to be rolled out?
Yeah, given this variant, given how much our health systems are struggling, how many people are dying, we've got to make getting vaccines out and into people's arms like priority number one right now. We have, probably 35 million doses of this vaccine sitting in freezers across the country. They're doing nobody any good sitting in those freezers. So we've got to figure out how to get them thawed, and we've got to get them into people's arms as quickly as possible. And I like the idea of using a National Guard if that's what's helpful. I sort of want an all-hands-on-deck approach here. Let's get these vaccines out, especially for vulnerable Americans, older Americans, who really could benefit from these vaccines.
All right, Dr. Ashish Jha, thank you so much for joining us. We appreciate it.
Thank you.